Hey everybody, good morning. This is Dr. Schultz with the Centeno-Schultz Clinic with another weekly update. This week we're going to be talking about what in the world is a hamstring tendinopathy. So thank you so much for checking in and let's get started. The goals of this presentation are to review the basic anatomy of the hamstring, review what in the world is a tendon, and more importantly, what is a tendinopathy? What are the major symptoms associated with a hamstring tendinopathy? And what are the causes? So the hamstring in its basic form are three major muscles in the back of the thigh. They help you bend the knee and extend the hip. And they're illustrated here. So here they are. Here are the three. The Semitendinosus, which is this muscle here. Now it starts here at the sits bone, and then it goes down to the posterior thigh. The second muscle next to the semitendinosus is its brethren, otherwise known as the membranosus. And on the outside is the biceps femoris. So the hamstring is basically three muscles in the back of the thigh, which are made up of the semimembranosus, the tendinosus, and the biceps femoris. What in the world is a tendon? A tendon is a thick, fibrous connective tissue that basically anchors the muscle to the bone. It does it at 2 points, the point of origin where it starts, and then where it inserts distally. So you can see in this illustration here, in this red circle, this is the origin. Where in the world does it all start? Of the hamstring. And then this is the insertion. So again, there's got to be 2 points of anchor. What's important about this discussion is where does the hamstring origin start? And it's all very familiar for people that are enjoy yoga and other athletics because it's right on this sits bone. That's right. The tendon associated with the hamstring starts right on the sits bone, or otherwise known as the ischial tuberosity. So what in the world is a tendinopathy? Basically, it's a collective term that refers to injury or dysfunction of a tendon. So for a hamstring tendinopathy, we have injury or dysfunction of the hamstring tendon. And the most common area of involvement is at its origin at the ischial tuberosity, i.e. the sits bone. So here it is. What are the most common symptoms? They are pain in the tail. That's right, pain in the lower buttocks or the posterior thigh. And it's kind of an intimate area, and some people are a little bit reticent to tell you about it, but you need to palpate the area of the ischial tuberosity. It's right where this gentleman is pointing. It can be electrical, but more importantly, it's like a fire. There's also associated swelling or tenderness. There could be stiffness, and if in severe cases, there could be actually weakness or loss of strength. Because think, what does the hamstring muscles do? It bends the knee and extends the hip. What are the major causes? Well, overuse and repetitive stress, such as people that run and start and stop. So athletes, particularly soccer, but just because you don't play soccer doesn't mean you won't have a hamstring tendinopathy. Other causes include poor flexibility, improper training techniques, trying to get your miles up too quick or your weight up too quick, a previous injury of the hamstring, and an often overlooked cause is an irritated lumbar nerve. At the Centeno-Schultz Clinic, we are experts in the evaluation and treatment of hamstring tendon injuries. What's absolute key is an accurate diagnosis, because there are many, many causes of lower buttock and posterior thigh pain. And it's so important that you get the correct diagnosis. At the Centeno-Schultz Clinic, you will get a board-certified, fellowship-trained physician. Treatment options include, but not limited to, ultrasound or X-ray guided PRP or bone marrow concentrate. I hope this was helpful. Now you have a better understanding of what hamstring tendinopathy is, the major causes and the major symptoms, and we're here to help if you're on the sidelines. Thanks so much for checking in. See you next week.